And good afternoon to our fellow members of the media. We really appreciate this. We felt that it was necessary for us to start holding some routine press meetings because of some issues that are going on around the state. And we'll address those as well as some late breaking news that's happened just in the last hour or so. But as always, we'll start off by giving you the state of things in Northern Light Health. We continue to see an increase in the number of positive cases for COVID-19, both out in our communities as well as in our hospitals. As of this morning, we are caring for 29 total inpatients within our system. 23 of those are at Eastern Maine Medical Center, with 4 in the region who need to be transferred to Eastern Maine Medical Center because they require intensive care. 1 at Maine Coast Hospital, 1 at Mayo Hospital, 2 at Mercy Hospital, and 2 at Sebasticook Valley Hospital. In addition, our home care and hospice team is taking care of 1 patient who's positive for COVID-19 in their home. And with that, I'll turn it over to Paul for some employee vaccine updates.
Thanks, Dr. Jarvis. Last Friday, we communicated with staff about new vaccine requirements for healthcare workers, including the new requirement for COVID-19 vaccinations. We're trying to make it as easy as possible for unvaccinated employees to get the vaccine. We have clinics set up at every one of our member organizations across the state. Employees don't need to wait to be vaccinated. Each member organization has those designated walk-in sites and access. Employees can be vaccinated during work time, and we ask that they work with their leader to do that. In addition to our normal walk-in sites, we also have pop-up clinics and access to vaccine at our Northern Light retail pharmacy locations. To be fully vaccinated by the state deadline of October 1st, employees must have either a dose of Moderna by Friday, August 20th, their first dose of Pfizer by Friday, August 27th, or Johnson & Johnson vaccine by September 17th. Although of note, Johnson & Johnson supplies are greatly limited, and so we are not encouraging employees to wait to the last minute and instead to become vaccinated as soon as possible. Dr. Jarvis?
Thanks for that update, Paul. We're going to talk a little bit about booster shots. Just a short time ago, we learned that the Biden administration is preparing to begin administering booster shots for those people who have received their initial doses of either the Pfizer or the Moderna vaccine at least 8 months ago, starting the week of September 20th, assuming that the FDA and the CDC sign off on the safety and effectiveness of the doses at that point. As this is a very new development, we have not received guidance from official channels and await further instructions from the FDA. We remain ready to support the health to our communities, including booster shots, if and when they are needed. So more to come. We do have guidance on providing booster shots or additional doses of vaccination for those who are immunocompromised. We've had some questions about who specifically that entails, and here's what we can share with you about that. People with severe immune-limiting conditions will benefit from an additional dose of an mRNA vaccine, that is the ones from Pfizer or Moderna. At this time, boosters are not recommended for people who have had the Johnson & Johnson vaccine, but this may change in the future. Boosters should be given no earlier than 28 days after the initial series of shots has been completed. Individuals should, if at all possible, get the booster of the same mRNA vaccine for their initial doses. So if you've had 2 doses of Pfizer, you should get a 3rd dose of Pfizer, and if you've had 2 doses of Moderna, you should receive a 3rd dose of the Moderna. So who should get those shots? Those who are in active treatment for solid tumor or blood cancers. Those who are recipients of a solid organ transplant are currently taking some immunosuppressive therapy. Patients who are recipients of cell or stem cell transplants within 2 years of transplantation, or if they also are on immunosuppression therapy. Those who are on active treatment with high-dose corticosteroids, and those on certain immunologic agents that blunt the immune system. And lastly, those who have advanced or untreated HIV infection. Not all people with these conditions or undergoing these treatments should receive a booster at this time, and individuals' specific health and treatment plans should always be considered. Individuals with these conditions or using these treatments should work with their healthcare providers to ensure maximum benefit of these vaccines. Moving on, as we approach the start of the school year, most can agree that our children need in-person learning, but as safely as possible. The Delta variant is spreading through our communities rapidly, especially here in Maine. Children do spread the virus and can get sick enough to be hospitalized. More than 1,900 U.S. children were hospitalized with COVID-19 on this Saturday. A report out just this morning states that there were 121,000 new cases in children last week. That represents 18% of all reported cases and is a significant increase in the numbers just since the end of June. Preventing the spread of COVID-19 takes a multi-layered approach. This includes masking, distancing, hand hygiene, environmental hygiene such as cleaning and ventilation, staying home when ill, and vaccination. Currently, those under the age of 12 cannot be vaccinated, so are at higher risk of both contracting and spreading the virus that causes COVID-19. Masking, distancing, and cleaning are 3 attainable prevention efforts with proven benefit for the K-12 setting. We encourage these steps to provide a safe learning environment for our students, educators, school staff, and their families. And with that, we'll turn it over for you for questions. Andy?
All right. Thanks, Dr. Jarvis. Thanks, Paul. Today we'll start with WAGM. Corey, I will unmute you.
Thank you.
Go ahead, Corey.
So my first question is, what are your concerns with maybe some of the healthcare workers that will refuse to get the vaccine, either Moderna, Pfizer, Johnson & Johnson, and are you concerned that that will cause a burden on the already shortage of healthcare workers?
Paul, you want to start?
Sure, I can take that, Dr. Jarvis. I think certainly anytime employees choose to leave, that's concerning. But we do think that it will be a relatively small number who will ultimately leave. We have had employees who have stated that they didn't want to get the vaccine and were going to leave, and then have since had some questions answered, changed their mind, and have been vaccinated. So I think it's a very personal decision for many employees who are struggling with that decision. We are steadfast in our approach that we think this is the right thing for our patients and our staff and our communities. We're trying to provide as much support and education and information to respond to questions that employees might have to minimize any folks who feel that they need to leave healthcare as a profession. Northern Light Health, along with all other healthcare providers in the state, are under the same state mandate. So leaving healthcare is what we're talking about, not just leaving Northern Light. And so we're strongly encouraging any healthcare worker who's having questions or concerns to discuss those with us, and we can hopefully resolve those issues.
Okay. And my second question, being more about the booster shots there, did the FDA guidance provide any kind of reasoning as to why the mRNA vaccines are chosen for a booster shot, but not necessarily the Johnson & Johnson?
Yeah, that's a great question. So the question was, why are the third shots recommended for those who are immunocompromised only for the mRNA vaccines and not Johnson & Johnson? And it really comes down to data. They just have data to support this recommendation right now for the messenger RNAs and not the data to support doing so for Johnson & Johnson. So it wasn't an exclusion, it was simply a lack of data to support. And I want to emphasize that's really what we have done during this entire pandemic, is use science and data to make those decision points about what we were doing in terms of our phased approach initially for vaccinations. The reason why currently Pfizer is the only one that's approved for those who are age 12 to 18. This is all because of data that the FDA has reviewed and seen, as well as the CDC's Advisory Committee on Immunization Practices. So purely it's just because the data support doing that at this time. Of course that can change, and Johnson & Johnson may be added as needing a booster shot later on. Thank you.
Thanks, Corey, for your questions. Next up we have Caitlin, Bangor Daily.
Hey, good afternoon, Dr. Jarvis and Paul. Kind of following up on one of Corey's questions. My first question is have you actually seen anybody resign from the system because of the mandate?
Yes, we've had a small number of employees leave their employment early and decide that they would not participate in the mandatory vaccination and did leave. In fact, the first few employees who left did so over the flu shot prior to the state including COVID-19 vaccine with the required healthcare worker vaccination schedule.
And just to clarify, is that across the entire system or just in one hospital?
No, that's across the system.
Do you have a sense of how many?
I don't have a number of how many at this point. as I mentioned before, we have had employees say they intended to leave and then have decided to become vaccinated and have stayed. So we're still early yet to know what the total impact will be to our staff. Certainly we're trying to work with folks to make sure that they have the answers to questions to minimize that number, but I don't have a number to give you at this point.
Thank you, and apologies for so many follow-ups. My second, I guess, distinct question is, do you have a sense of how across, I guess like different kinds of healthcare workers in the system, your vaccination rates are, so like nurses versus like respiratory therapists and things like that?
So yeah, we do have breakdowns of our staff in larger groups. So our physicians, for example, are well over 90% vaccinated. Nurses and other clinical professionals are well over 80% vaccinated. I don't have a breakdown by respiratory therapy compared to nursing, compared to certified surgical technicians or technologists, but in larger groups, as I mentioned, yes.
Good, thank you for your questions. Next up we have WGME, Mal Meyer.
Thank you. I guess this question goes over to Dr. Jarvis, since we talked yesterday about how you could bring back plans that were used on early in the pandemic. If this includes mass vaccination sites, what will you do if those places are not available to use, like the Cross Insurance Center in Bangor? And how will you also rally getting hundreds, if not thousands, of staff and volunteers to also man these sites?
Yeah, so Mal, it's an excellent question. So it's kind of twofold. Is what are our expectations for need of large-scale mass vaccination sites, and then of course staffing concerns, which are a problem across all of healthcare settings. So we continue to evaluate what our situation is. We don't expect to have the need of very, very large-scale mass vaccination sites at this time. Why? Because the specific guidance here is to do this in a phased approach of individuals, who have been vaccinated for 8 months or more. So with that in mind, we can sit there and plan out exactly what we need. We do know that we've made the availability of vaccines so much better than we could initially, because initially we were hampered by the amount of vaccine we actually had, and that is not a problem for us right now. As of now, the state of Maine has an adequate supply of vaccine. We would rather be giving that to more people than having it on our shelves. And so this is just another avenue for us to utilize the stock that we have. And so we'll continue to work on efforts. If we need to open up particular locations, we certainly still have partnerships around our communities around the state if we need to do that, as well as within our own facilities being able to make adequate space. If you remember, our initial forays into doing public vaccinations were at Eastern Maine Medical Center itself, and so we do know that we have adequate space that we can put through several hundred people in a location such as that safely, effectively, and not during the horrible weather that we were dealing with initially during that vaccine process. So that's good news for us. We continue to work with our partners. I have a meeting with the state later today. Many of us in the Bangor region have a meeting on Friday, and so we continue to really look at all of the things that we'll need to do as a community and as a state to keep Mainers safe and healthy, and that's our number one job.
You mentioned just now that you are going to be in discussion with state officials about this latest development. Have you heard any indication of how the state will stockpile vaccines in anticipation of thousands of Mainers suddenly needing a third dose?
Yeah, so to be clear, my meeting this afternoon actually is surrounding hospital capacity issues and concerns there. But I imagine that this will come up as well. But this is brand new information to us, and so it's way too early for us to talk about what logistics will be or what plans will be in place, because this is a new announcement just since this morning from the Biden administration.
Thanks, Mal, for your questions. Next is Patty White, Maine Public.
Thank you very much. Dr. Jarvis, what's your reaction to this recommendation for booster shots? There's some people who are saying that they really aren't necessary for, a broad swath of people, that they should be directed only to people that are the most vulnerable. So what's your reaction to this recommendation?
Yeah, so I haven't had a chance to look at the exact data that the FDA and the CDC were looking at when the administration made this particular determination, but I do have faith in them. They have been very good in looking at the data and analyzing it. Since day one, I have been one of those that have been saying, I believe we will need to have booster shots at some time. I expected that to happen this fall, so that fits in the timeline that I've been predicting. So I kind of go along with that notion. Also thinking of that, it would be more of a time-limited thing, meaning that that 8 months would have had to have passed since the last time that you gotten a vaccine before you were eligible for a booster. So I think that fits in line with what many of us have thought and said based on information we knew about coronaviruses before this pandemic began, and that just kind of fits in line with it. But again, we will look at the data and we will analyze it. And again, Northern Light won't do anything without particular guidance from both the CDC and the FDA.
Okay, thank you. And Paul, you talked about some staff leaving over the vaccination requirements, but what can you tell us about an increase in vaccinations? Have you seen a noticeable increase in vaccinations among staff?
So we've seen a noticeable uptick in vaccinations over the past few weeks, and certainly since we communicated the state's mandate and the timeline for the October 1st fully vaccination date. So we have seen staff move forward and get vaccine. We are just a little over 81.5% vaccinated at this point system-wide. And so we continue to process vaccines as quickly as possible and are eager to vaccinate our staff.
All right, thank you, Patty. Next we have Chris, Center Maine. Chris, you should be able to unmute now.
Thank you. Mr. Boland, I just wanted to ask kind of a similar question related to what Patty had just asked. Do you know how many of your staff have been vaccinated since the state announced its mandate on Thursday?
I don't have the number of vaccinated in the last 5 days, no.
Okay. Do you know how, just then to follow up then, do you know how many have gotten the vaccine since Northern Light announced its internal mandate?
I know we have, I don't have the exact numbers since the mandate. I know in the past 2 weeks we've vaccinated at approximately 3% more of our staff. So that number would be in line with those who've been vaccinated since we announced our mandate and then subsequently the state's October 1st deadline.
Got it. And the second question is for Dr. Jarvis. Dr. Jarvis, we've obviously the development is new regarding booster shots. We knew about them for the immunocompromised, I think, on Friday, and now it's going to be open to the general public. What is your message to people who are concerned about the efficacy of their vaccine as it stands right now knowing that there is some evidence to prove that a booster shot is recommended?
Yeah, that's a great question. And so first and foremost, the vaccines that are currently authorized in the United States, the Pfizer, the Moderna, the Johnson & Johnson, are incredibly effective and all very, very safe vaccines for use. In fact, probably among the most studied vaccines we've ever had. And so to be clear, they are incredibly effective. The issue now is the transmissibility of this Delta variant. And because of that, we have seen breakthrough cases of COVID, meaning people who are fully vaccinated still getting the infection. Thankfully, severe disease, hospitalization, and death is extremely rare in those who are vaccinated, but they still are sick. And so it's really the rationale to try to limit that as much as possible, because even if somebody was to have a breakthrough infection and it be mild, they could still spread the disease to people who are unvaccinated or people who their vaccine has not worked as well because they're immunocompromised. And so that's really the protection there. Really what we want is to have nobody being sick from COVID-19. No vaccine is 100% effective, though these vaccines exceed any of our expectations as to what a vaccine efficacy could be like. But because of the rapid transmission of the Delta variant and the number of people who are currently sick, it's not surprising that this recommendation is coming out in order to protect us even further than we've already been protected by those of us who've already been vaccinated are currently protected.
Next up we have Eric, Portland Press Herald.
Good afternoon to you both. Thanks for taking the time. I want to see if you can give me any sense of what the hospital population for COVID patients is looking like. Is it younger people? Is it people who are unvaccinated primarily? Give me a sense of what you're seeing.
Yeah, so the majority of patients that are in our hospitals with COVID-19 are unvaccinated individuals. At least 80% of them are unvaccinated. Unfortunately, these individuals are sicker than we saw in the past, and that's concerning to us. So when we talked about having large numbers of COVID-19 patients, many of them simply needed oxygen support or something like that. Now we're seeing that they need critical care. Many of them are on ventilators, and many of them require now 2-to-1 nursing. Not that that each nurse is taking care of 2 patients, but 2 nurses need to be taking care of 1. And that's really across the state, not just at Northern Light Health. And so that's what I want to stress. This Delta variant is definitely causing us to see more patients with more severe illness. And so if you are unvaccinated at this time and you are eligible for vaccine, we implore you to get vaccinated. Remember, while I said that the storage of the supply of vaccine is plentiful here in the state of Maine now, once we start giving out boosters, that supply will go down. And so if you're contemplating, if you're close to making that decision that you want to get vaccinated, please reach out to your provider, finish getting your questions answered, and please get vaccinated. So thank you for the opportunity to give that message.
Thank you. And the second question I had is, based on the last few days of case trends, we're seeing a lot of transmission in Penobscot County, where you guys do a lot of your work. What are you seeing in terms of how this is being transmitted? Is it simple community transmission? Are there outbreaks? Do you have any sense of what might be driving it more so in that part of the state, or not?
Yeah, I don't have any specifics there. We do know that the community transmission is high or substantial in almost every county in the state of Maine, and really that's what we're seeing as we talk about our partnerships across the state. Here in Penobscot County, I don't have any specifics. I'm unaware of anything that's been declared an actual outbreak, but certainly all of us are aware just by looking at media reports of the number of businesses who have been affected. And also things like daycares and summer camps and things like that have been affected with people who have been infected with COVID-19. And so, this is what we started to see last late October, early November into December. Only now we're seeing it here in August before schools start again.
All right, thanks, Eric, for your questions. Now I'll go to Allegra. Yeah, you should be able to unmute now, Allegra.
Hi there. First question is just more regarding back to school. We see a lot of parents sort of questioning mask my children, not mask my children, some school districts requiring, some not. What are some things that maybe you could offer to sort of either ease the stress that some parents are having right now, or sort of offer clarity as to why some of those masking recommendations are so important?
Yes, that's a great question, Allegra, so thank you for asking that. So first and foremost, the things we need to do is protect those people who cannot be vaccinated. So if you have small children in your household who are ineligible to get vaccine at this point, get vaccinated yourself so that you don't contract the infection and then spread it on to somebody else. So that's our number one strategy, is to try to get as many people who are eligible for vaccine to be vaccinated. Within schools, certainly there's a lot of discussion about that right now. However, we do recommend that masking should occur in schools with all children, staff, and teachers being masked. This is just another layer of protection that can happen in addition to physical distancing, making sure that surfaces are cleaned, and most importantly, washing our hands frequently. And so we do encourage that masking occur within schools as a layer of protection. I know there's concerns there about socialization issues and things like that, but I can assure you any child who's sick enough to be in a hospital, that is certainly a risk that I would not take over the risk of wearing a mask. Most of our children are highly resilient. They did very, very well when they were in school last year. And really what masking can help do is prevent the spread from person to person, and therefore we will be able to continue to have in-person class during the entire school year, and that's important. If we want to talk about disruptions of socialization, it is having your child go to school, then have the school shut down, and then the child going back and having that continue throughout the school year. It is much better for us to start off with a clean slate, doing all the preventative things we can do that's possible to keep our children safe and keep them in school for the entire school year. So thank you, Allegra.
Thank you so much. And then one more question. We just have a lot of viewer messages, people, concerned with all of the changes and the change in recommendation and, well, what about this? You said this. What can you offer as sort of just a explanation as to why it's normal and okay that things might change and recommendations might change even from here on out?
Yeah, that's another great question. And so the reason why things change is because the science and the data changes. What we were dealing with last fall when we opened up schools was the original strain of COVID-19. We had started to see some hints of some variants out there that may or may not have been more infectious and caused more disease. But this new Delta variant, in fact, in my opinion, this new Delta variant is as if we're dealing with a completely different virus. It acts differently, it spreads more readily, and it appears to, at least in some individuals, be causing more severe disease. So why are things changed? Because the playing field has changed. The data that we have supports that we need to go back to doing some of those initial preventative things that we talked about almost 19 months ago, such as hand washing, keeping our physical distancing in place. Then we added masking when masks were in ready supply and we knew more data that they would help prevent transmission. Those are the reasons why. It's the facts on the ground that have changed the situation for us. This Delta variant is very serious. It is spreading rapidly across the country. In other states that did not take effective preventative measures, they are dealing with those consequences. If we look at some very large southern states right now, thousands of children are no longer going to school. Remember, their classes started at the beginning of August because of outbreaks within their schools. We don't want to see that happen here in Maine. We want our children to be in class, and so please support putting masks on our children, our staff, and our teachers, because this will assist us in preventing the spread of any further disease.
All right, thanks, Olivia. Now on to Blake.
Yes. First question has to do with long-term COVID-19. How many people are you seeing in the health system that you're treating for that are having some long-term COVID-19 symptoms? And are you seeing a lot? And has there been any talk about possible plans for treatment for the future should the Delta virus increase these long-term symptoms in people? I've seen in other places across the country that they have specific parts dedicated to their healthcare system to help people dealing with long-term COVID-19 symptoms. So I'm wondering if that's been a discussion between you guys and just how many people you're seeing dealing with this.
Yeah, so trying to quantify the numbers is difficult, particularly here in Maine, where thankfully we have done very well in keeping our overall numbers of COVID-19 at a very low rate. In fact, we're usually in the top of the country as being one of the best preventative states, and certainly we are one of the best in vaccination. So it's hard to quantify that. We do know that there are several individuals that we are currently caring for who would fit the definition of long COVID or prolonged COVID syndrome. And so we are caring for them presently. I'll give a shout out to Northern Light Mercy Hospital, which already has in place a program for assessing, diagnosing, and treating those individuals. We continue to talk as a health system as to how we can leverage that. We work with our partners in other parts of the state as well as with Massachusetts General Hospital, who gave us a wonderful lecture recently on how to care for these particular individuals. And so we are prepared and continue to do that. We will continue to monitor and make adjustments to our care plans as need be. And if we need to set up any more formal sites for assessment, we will continue to do that as well. So thank you.
Wait, did you have a follow-up question? I'll unmute you again in case you do.
Yeah, I think I want to go back to the school districts too as well. I've been seeing a lot of places, they're starting to talk about this more. A lot of places have either required masks, said it's fine without it, or I've seen even some places they're only requiring masks in high traffic areas. My question to you is is that enough for a school district that makes that kind of decision, masks in high traffic areas or things like that? Is that enough to prevent the spread of the Delta variant? And could we possibly see more hospitalizations in the coming months if school districts don't act on this?
Yeah, so I sometimes do predictive analysis and sometimes I don't. So I won't make a particular judgment on whether we will see more things specifically related to schools. I do feel over the next couple of weeks, because of our trend in our increased positivity rate, we will probably see increased hospitalizations that usually lags 2 weeks behind our stark increases in our positivity rate. As far as effectiveness of masking, my concern when you start talking about we're only going to mask in this particular area of the school and not that particular area of the school, or this classroom and not that classroom, is it does become confusing for children. What we do know is that if children have consistent standards, they are more likely to follow those consistent standards and do well with those consistent standards. And so that's my assessment. If we're gonna kind of do a haphazard thing within a school, I will once again say that the transmission of COVID-19 in all of our counties but one right now is substantial or high. That puts it in the category where the CDC states everyone indoors should be masked. Doesn't talk about schools, doesn't even have to be a portion of schools. It is that if you are indoors, you should be masked. And so we should be following that guidance regardless of whether we're talking about schools or hospitals or any other business or industry around the state. It is important that we protect one another, and masking is a layer of protection in addition to all of the other things that we talked about.
Thanks, Blake, for your questions. Next we have Ross, WMPW. Ross, you should be able to unmute you.
Hi, thank you very much, and thank you everybody for all your time. My question is about the booster shots. So messenger RNA vaccines, still something very new. In fact, everybody got their first one ever with their first dose of the vaccines earlier this year. I'm curious if you can share, maybe in layperson's terms, if there is anything materially different about a booster shot for an mRNA vaccine, specifically the ones for either Pfizer or Moderna, that maybe are different from like an annual flu shot or a tetanus booster shot. And explaining exactly what these booster shots are. Is it basically just the same thing that went into arms earlier this year, or is there something materially different about them?
Yeah, so I'll answer the last part of that first. So yes, these are the exact same vaccines, the same dosage that were administered for your first and second dose of either the Pfizer or the Moderna series. I want to clarify, messenger RNA technology is not new. It is something that has been around for decades. It is just the utility of using it for this particular vaccine that is new. And so I want to be clear on that. Messenger RNA technology has been around for a long time. It's remarkable how fast we were able to develop these, and as we said in these press briefings before, that was because that was a private-public partnership. Federal governments, including the United States and under the Trump administration, supported private companies with funds so that they could bring that technology to bear much sooner than we would normally see. So I want to be clear on that. The only reason why we're seeing the difference here around booster shots here than say with a tetanus shot is we do know that when you get a tetanus shot that your immunity tends to last for 5 to 10 years. So that's wonderful news. That's the reason why we talk about a booster shot for tetanus every 10 years, but 5 years if you've had an incident that may put you at high risk for tetanus. Influenza, we know that your immune system for an influenza vaccination lasts somewhere between 9 and 12 months. We also know that the influenza virus changes very readily. That's the reason why we need to have an annual flu shot, because we need to, one, counter the fact that our immune system wanes after 9 to 12 months, and two, that the virus changes. So what's different about the coronavirus? Well, it's this coronavirus that's the issue for us. It is changing rapidly. You don't hear us talk very often during flu season about a new variant that came up during flu season. Yet we are now talking about the third major variant that has become the predominant strain just this year alone. And so that's really the issue there, is that while you've gotten protection, as this virus changes, and it's changing more rapidly than we've seen coronaviruses do in the past, your immunity is probably going to shift a little bit. Plus, we also know that naturally, our body's own immune system, when we get infected with a coronavirus, does wane. Coronaviruses make up about 60% of respiratory viruses in adults. And so many of us don't get just one cold a year. We might get several colds a year, and that may simply be from coronavirus reinfection because our natural immunity wanes. And we don't expect that to be any different with this particular coronavirus. What we do expect to be different is the symptoms that it causes, the devastating disease it has caused, and then the fact that it is rapidly changing. So that's the reason why it's not so much the change in the vaccine, it's really the change in the virus. So thank you for that.
Thank you very much.
Last but not least, it's my fault our wires get crossed, but Leanne, WAGM, I know that you jumped on. You had a couple of questions. I'll unmute you. Yeah, did I get your name right, Leanne?
Yes. Yeah. Hi, Andy. Thank you. Yeah, I just have a question, and I hope this isn't redundant, but with the Delta variant making up 100% of the sampled cases in August, what does this, do you guys have recommendations on how Mainers should be changing their COVID safety precautions?
Yeah, so one, I'm not sure where you got that particular number for. I'm not sure that 100% of cases are Delta variant, but certainly a large percentage of our cases here in Maine are Delta. Again, we don't test every single positive case for what type of variant it is because clinically we treat, it doesn't matter which variant you had, the treatment for COVID-19 is the same. So I wanted to be clear on that. But certainly the Delta variant is spreading far more rapidly than we've seen previously. So I continue to talk about the CDC's recommendations. I strongly support the current recommendations of the CDC, which is that you continue to practice good hand hygiene and wash your hands on a regular basis, that you wear a mask when you're indoors, regardless of whether you're vaccinated or not, if you're in a county of substantial or high transmission, which again is almost all of the counties in the state of Maine. And then lastly, that you get vaccinated if you are not vaccinated. It is so important. What vaccine does, it not only protects yourself, but it protects everyone around you. If you're less susceptible to getting the disease, you're far less likely to spread the disease to somebody who can't mount an immune system or is not eligible for vaccination, like any child under the age of 12. So that's the importance of that. It is now looking at each and every one of us to say, what can we do as Mainers to support every other Mainer that we come in contact with? And right now, the best thing that you can do is be vaccinated, to stay socially distanced when appropriate, and to wear your mask when you're in an indoor public place. And with that, I think we're done with our briefing.
Yep, indeed. I think we've gotten to everyone. So thanks again, everyone, for attending today and helping us get out important information about COVID-19. As I mentioned at the beginning, a high-quality video file will be available this afternoon. This is typically available an hour and a half or so after the briefing. Just let us know in the chat or by email after if you'd like a copy. I'll get that off to you. So, thanks again for joining us today, and have a great rest of your Wednesday.
Thank you, everyone.
Thank you.